Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. So in this video, I will go over 5 easy tips that you can do at home to relieve your jaw pain. So there's a lot of different issues could happen for the jaw, but those tips usually help with musculoskeletal issues, and I will have more videos on jaw pain and different diagnoses and how we address it. So first tip is sit up tall, especially when you're eating or talking. So do not eat or talk while you are in this position, because this position actually going to put stress on your jaw joint. So let me show it to you on the side here. So forward-headed slouching posture actually gonna compress and eliminate, like limit the range of motion in my jaw. When I sit up nice and tall, I have more room to open my jaw, so I will have less issue or especially when I eat or talk. Second tip is imagine there's a string pulling your head up all the time. So that will help you to correct that bad habit, bad posture of slouching forward-headed to sitting up nice and tall. Third tip, move around every 20 minutes while you're sitting in the front of the computer or TV. Have a timer, a sticky note, every 15 minutes, get up, walk around, move your head, your neck around. The fourth tip is to keep your teeth apart. So it's a very common issue with patient that has jaw pain or TMD or TMJ pain, that they are clenching or grinding. So one of the ways to avoid that, they need to be mindful of keeping their teeth apart. So your lips is closing, but your teeth not touching each other. That's a very important tip. So what I noticed with those patients, they actually clench even throughout the day and at night. So it's gonna take a little bit time for someone clenching or grinding to change that habit throughout the day, and it usually takes 2 to 3 weeks to change a habit. So as long as you're consistent, you have a reminder, sticky note, or reminder in your phone or your computer, a timer, you will be able to change that habit. And the fifth tip is rest your tongue on the roof of your mouth or behind the front teeth as much as possible. So that's in a normal resting position. When someone clench or grind, their teeth usually touching the bottom of their mouth, and that will actually cause more tension in the masseter muscles. So tip 4 and tip 5 goes hand by hand. So make sure you do both at the same time. It's gonna take you 3 weeks if you're consistent to stop clenching during the day or grinding if you use those 2 tips. So teeth apart and keep your tongue either in the roof of your mouth or the front top teeth, and that will help you to avoid clenching. The last tip is, and actually this is a bonus tip, number 6, avoid exercises or activity that exacerbate your symptoms. Just be aware that you open your jaw 3,000 to 4,000 times a day. And unfortunately, when you look on YouTube, you will find a lot of people say, oh, just resist your jaw this way, resist it here, resist it here. I've been working with TMJ patients for so many years. I never gave resistance exercise. You don't need to do that. You don't need to strengthen your jaw muscle that's already working 3,000 to 4,000 times a day. you need to avoid dose-resistant exercise. So I hope this tip's helpful. It's gonna help for the patient that does not have a lot of issue with the scar tissue or fascia restrictions. And to learn more about scar tissue, fascia restrictions, and ASTR, and how to address the jaw pain effectively, check other videos that I have in my channel. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.